You are listening to Pharmacy, IT, and Me, your Informatics Pharmacist podcast. Hey everyone, this is Tony Dow, and welcome to another episode of Pharmacy, IT, and Me. As with every episode, we start off this one saying that the intended audience for this episode are newcomers to Pharmacy Informatics. So I want to just start off saying that this episode is going to be about what is Pharmacy Informatics, and it's actually a revisit on this definition. So early on in the podcast series, I started off with an episode about what is Pharmacy Informatics. And, over 100 episodes later, I wanted to revisit this question because there's just been so much that's evolved in the past year. And also, just speaking with all these different individuals who work in different spaces of healthcare technology that's involving with pharmacy, right? So I think there's still some questions about just exactly what Pharmacy Informatics is and what it means. So what is the formal definition? There isn't really one particularly correct definition. Some of the problems with the definition is that everyone thinks it's just pharmacy technology, using technology in the pharmacy space, like fixing this pharmacy computer system, or, if there's an issue, troubleshooting it, and fixing barcoding if there's a scanner issue. So it should be understood that, it's much more than that. So, don't get me wrong. I'm not saying that Pharmacy Informatics doesn't have a technical build and troubleshooting aspect, but Pharmacy Informatics is still very rooted and connected to healthcare technologies. This is probably why some organizations like, ASHP, the American Society of Health Systems Pharmacy, they categorize it into a term called Pharmacy Informatics and Technology. So ASHP has a section. That section itself is actually called the section of Pharmacy Informatics and Technology. So what is that technology component like? So within pharmacy technology, there are different pharmacy verification systems, pharmacy ordering systems, for 340B splitting, clinical decision support systems, inventory systems, digital health systems, and a lot more that, I can't really cover in this episode. These systems can enhance care, they can improve provider or pharmacy workflows, they can basically make a pharmacist's job a lot easier, maybe over time. And maybe these systems are also there to help pharmacy personnel meet regulations required of them by local or federal law. Then you have the side that's more in line with the term of informatics. So informatics is defined specifically as the science of information. That's what the word means. If you consider healthcare data, there's a lot of healthcare data out there, and we have to figure out how to create meaning out of them for actionable workflows and actionable improvements. And it's not just in the regulatory side, but also in the clinical improvement side. So Pharmacy Informatics hones in on this, in that the information collected on the medications, refills, type of medications prescribed, disease states, and more, they can all be used to make decisions that can affect either, that specific patient or maybe on a grander scale, like in terms of population health. So what I just said is that there's two components, the very technical build maintenance side, and then the side that looks into data for clinical improvements. These two are not mutually exclusive, and they are related in that you need to have certain technologies in order to perform the data analytics. And you also need to have certain technologies to collect that data, right? So because of that, there's a blurred line between the two. And so, a pharmacist that works in informatics, they may not only have to do the analytics side, but they may also need to do the technical build side, since they are supposed to be, the medication operational flow experts. And having said that, this can also be further broken down depending on the institution that the pharmacist is working at. So in maybe a larger institution where there's more funding and more staffing, there may be an informatics pharmacist that's focused more just on the technical build and troubleshooting. And then there's that pharmacist will work closely with another informatics pharmacist whose main role is to perform the actual data analytics and create clinical improvements in the operations. So, it's also to note that one of these pharmacists may need to know programming while the other one does not. And, that goes back into, it's important to understand that being an informatics pharmacist does not mean you are required to know programming, but you need to know at least the operational flow and how to improve it. So going back into, why I kind of revisited this question, the point of this episode is to highlight that the term of pharmacy informatics is very wide-reaching in terms of, pharmacy data analysis and application technology. It's a popular misconception for those who are not in the field to think that pharmacy informatics just means, hey, you work on creating alerts in the system, and hey, you fix printers, anything that the pharmacy needs. So it's much more than that. And it gets a lot more detailed the more specific and specialized you go. Alright, if you like our show, please share with your friends or help us out by giving us a rating on Apple Podcasts or any of your other favorite podcasting services. Check us out on social media on Twitter, Facebook, Instagram, or LinkedIn, and you can also reach out to me at tony@pharmacyitme.com. If you want to be part of a great networking group, you can also join the Pharmacist Slack at pharmacistconnect.com, which is pharmacistsconnect.com. There's many great people on there with different topic channels, including pharmacy informatics. I've met great colleagues on there, and I look forward to chatting with you as well. So thanks again for listening, and remember, technology is a tool, patient care is the goal.